Lady D Denise Gomez, and I have exciting interview segments and features inside the zone. For recording artists, you can sing. Well, Inside the Zone, second Thursdays at 7:30 p.m. is for you. Writers, share your story, no man, in From the Author Zone on third Thursdays at 7:30 p.m. Male Zone has unbelievably juicy stories of love, heartbreak, and triumph. 7 p.m. has never been this good. On Mondays, it's news, talk, engaging features at 7 in the Monday Drive. And Center Stage has everyone talking on Thursdays. Be a part of the show. Email me inside the zone nyc at gmail.com or call me 914-304-2592. For 2 days, the 5 o'clock hour is hot on Fit FM 96.7, www.fitfmja.com. Your life, your music with Lady D Denise Gomez inside the zone. Catch me on Monday at 5 p.m. for the Monday Drive, keeping you in the know in the city you walk, drive, and reside. And on Friday, yes, at 5 p.m. for Center Stage, the platform where voices are heard and people connect. From abroad to yard, Trelawney. Hi, I'm Lady D Denise Gomez, and I have exciting interview segments and features in. It's Breast Cancer Awareness Month, and woman, you are our priority. How often do you do your breast exam or have your mammogram done? Remember, early detection saves lives. So, put aside the powder, oils, myths, and stories about treating breast cancer because we have a doctor, Satideh Mawnin, Dr. Renee Clarke, a certified family nurse practitioner of Dykal Health and Wellness, ready to inform and educate you on the importance of taking preventative measures and self-care. At Satideh Mawnin Runnings, come, make we talk.
Well, it's Saturday. It's Saturday. It's Satideh Mawnin Runnings. With Daya. It's my pleasure being here this morning. On a notice, Miss Space in a different location. But the show goes on, and somebody else is in a different location, but we'll get to that. But I'd like to welcome everyone this morning to Satideh Mawnin Runnings. When we say Saturday, people from Jamaica and some parts of the Caribbean connect right away because it's either we are calling from a hilltop, we down a river, we down a crossing or crossroad, or we upon we veranda, we out in the backyard, we over the orange grove, the banana grung, we are pick something, we are greater something, something tell we that, oh, is a yard effect, this. So when we say Saturday, we're simply saying Saturday or Saturday, depending on where you are, or Saturday, depending on where you're there. So it's a pleasure having you this morning. And this morning, I'm sure will resonate with everybody because when we talk about Breast Cancer Awareness Month, we're talking about a sister, a daughter, a mother, a auntie, a grandma. And then it's the collective of people who come together now and build a family. So if it's one affected, it simply means it affects everybody.
All.
Mhm.
Oh, yeah.
everybody becomes affected, that unit, that family unit and community. So we'd like to welcome you. And there is someone who is just, beaming, and saying, mhm. So I'd like to welcome Dr. Renee Clarke, DNP APRN of Dykal Health and Wellness. It's not my first time having a conversation with her. And this morning, I'm so happy. I was so happy when Renee said yes, because I'm like, Lord, we have to go move quick here now. Because there are certain topics when you're featuring them, you just can't just talk,
Sure.
right? You
We
have to
have to
have,
defer to the pros.
there you go. There you go. So I'd like to welcome you, Renee. I'd like to introduce you to Maxine, aka Max Point. That's Maxine Lyons, and
Hi, Renee.
you'll be hearing a piece from her. Then this is R. Sherns, the conscious one, Brown.
Pleasure.
That's
It's Barry
Shernet.
now.
Oh,
Yes,
yeah. The
yes,
local girl. The
the
local girl.
local girl. And then Jackie will be joining us. And there's we have Jennifer Douglas, but she has not been with us for a few weeks.
Okay.
Pressed with matters, but we have a cool crew around here, and we keep our audience engaged and informed.
All
A
right.
little entertainment as well, like last week when we had our music then and now. We
And
were
now, yes.
playing up some tune and things like that. So, Renee, you're in a good space. It's
All
just about
right.
conversation, and we know how you Irie already. So,
Of course.
that makes it well. So, I'd like you to go ahead and greet up with people, introduce yourself, and then we'll start talking.
All right.
So, go ahead, introduce yourself.
Okay, I'm so sorry. So
Yeah.
I am Renee Clarke. I am one of the owners of Dykal Health and Wellness. We are located here in the sunny, beautiful state of Florida. The best state, of course.
Yeah.
This is Kingston 954, as everybody knows. We really didn't leave Jamaica.
Right.
I was
1 hour and 20
about
minutes door to door. Don't ask me how I know. I just know. 1 hour, 20 minutes door to door.
Yes,
Such a
yes.
pleasure being here with you all today. My husband and I, Kevin, we are the owners of this beautiful facility. We are primary care providers, and we also do a lot of weight loss in our clinic. We have a great brand ambassador, Lady Tifa, who is our big promo for our weight loss. We also offer all things hormone replacement. We take care of guys with erectile dysfunction. We do contraceptive therapy. I mean, you name it, we are able to do it. We're licensed in California, in New York, and in Florida. So we're happy to serve the diaspora. And we do lots of speaking engagements. Lady D and I have worked together quite a while. I think probably this is our third or fourth engagement, Lady D.
Yes, yes.
Very happy to be here joining the beautiful people here this morning.
Of
Thank you.
course. So thank you so much. And meet Jackie Brainbox Tyson,
Morning, morning.
presently in nursing school and doing exceptionally well.
Awesome.
Never tired. She just
Hi,
keeps
how are you?
going.
Awesome.
Oh my goodness,
Morning,
has
Jack.
been a very busy morning. And, I was up until this morning studying and doing schoolwork. So it never
Yes.
ends. Then I still have the family to tend to. So
Say that.
here I am.
as
I'm here with my
I'm strong.
oh, they didn't tell you that I'm the crazy one. Anyway, but
Yes.
I'm here with I'm strong. My sister designed this T-shirt because she's a survivor, and
Love.
this is her first one in many years. And I was the first to get one. She presented it to me, and it was a surprise. And I'm wearing it today.
I love that
Oh,
for you.
So
very nice. Nice. Nice.
yes, Maxine, your friend, Natty, Natty shirt.
Yeah, nice.
Okay.
Very good.
Great. Great. So Renee, we have a very interactive platform here with our viewing audience. So they'll be posting questions and, all of that, make their own comments. And so, guess who is first in line, Renee? Take a
Can't be
look.
my mother. Can't be my
Herman.
mother.
So, Renee is Herman's daughter. Okay.
Oh,
Okay.
okay.
Nice. Very
Yes.
good. Well,
Okay.
Herman is an ardent watcher and listener.
Yeah.
Yes. Yes. And
Always
Oh
here,
my
and Andrew as
How much
goodness.
well.
I know. She's in Turks and Caicos right now, enjoying
yeah,
her best life.
Okay.
might as
Wonder.
well.
Nice.
She worked hard for it. She worked hard. Then there is Andrea, a good friend of mine who now lives in Barbados.
All
So
right.
that's that. Then there is Vero, who I've known for many years, and she's here
Morning.
with us. So
Morning, Vera.
your mother sent me there too.
There too.
And then there is one of my sweethearts from my church, Viola. So I
Pleasure.
call her
This
Charles.
is all at all times. Yes.
And good morning to Tony. Good morning, Tony.
Good
Mhm.
morning.
Yes, so we're inviting everyone as you enter the room, please to share the link with at least 5 persons. Let them know it's our breast cancer conversation, Women Talk Breast Cancer. And I would like persons to really come on and be informed. So, ladies, welcome, welcome, welcome. It's the month of October. And it was just on Thursday evening, I shared a clip with a breast cancer survivor who lives in the Turks and Caicos Islands, and how she found out that she had breast cancer, subsequent treatments, and so on. But as a woman of faith, she really had a community of people supporting her, praying with her. But her
Oopsie
husband,
daisy.
as he sat there next to her in that interview, I could see that the man was just there for the full haul. And she spoke so highly of him because sometimes I'm sure when the diagnosis comes, everybody gets a little nervy. Some people
Yeah,
can't manage it, some people
yeah,
can't this, and it becomes
yeah.
so overwhelming for the person adversely affected.
Right.
And
And that's when you need a good support system.
that's
Yes.
right. So she was able
So
to
you
go
don't
through
fall
that.
apart. Persons around you ought not to be falling apart at the same time. Or at least
Mhm.
not visibly to you then, who needs
The
the
support.
encouragement and so
Right.
on.
Mm-hmm.
And as you notice, when I thought about how should I do the promo this week, because we're from a culture that oftentimes we're not proactive. So we may either have felt something and say, "Oh, I just want little something, it'll go away," and we do
Yes.
nothing, and we and
Drink it.
yes, we whatever it is, we just say we will take care of, we'll get
Brush it
to it,
off. Brush it
and
off.
usually
Yeah.
we don't get to it, and
Mm,
then we have to be doing damage control,
Absolutely.
find
yeah,
ourselves in a crisis situation, and
Yes.
oftentimes and not, it's when it gone too far.
Absolutely.
Right.
yeah. But
So
then on the
Mm-hmm.
other hand, we have had people who they may have a family history of it, or they, for whatever reason, they may just say, "I prefer not to know." But
mm,
one
That's
young lady I know, she thought that's what it was, and I was encouraging her to go to the doctor, and she said, "Look, I prefer not to know." So
mhm.
it's kind of unusual.
Yes.
Yeah.
Alrighty. So, Dr. Renee Clarke, I'd like you to, share some pointers with us as we talk about it. And to our audience, please share your comments, your concerns. You can either cite some
And stories
examples or
too.
something that
yeah.
that
Yeah.
you can share with us to make the program quite meaningful and helpful to someone.
Yeah,
Yeah, I
because
think
somebody's experience, may help somebody else. Just
absolutely.
the way
Absolutely.
they went about their treatment and
Mm-hmm.
stuff like
Yeah.
that. Just sharing it could be valuable to somebody else.
Yeah, I
Right.
think
So,
you mentioned a great point that in our diaspora, many of us are sort of reactive. The concept of preventative care is not very etched into our DNA. Maybe for the younger generation, we are now understanding that annual health maintenance exams are very, very important. And for those who have had the privilege of education and travel, and we are now more understanding of the benefits and the values of those things. But you go back to Jamaica oftentimes and you'll ask the question, when was the last time you went to the doctor? And the first thing someone will say, well, I'm not sick. And
Yeah.
you are trying to just get them to understand that, listen, every day you go and you have a car and you're putting in gas in that car, you're doing some form of like little bit of maintenance, but you really need to do a solid maintenance at least one time per year for that car, right? It's this
Yes.
car that you
Yes.
really the men, they understand that concept very, very well. So when you put it to them like that, they said, well, yeah, I love my car. I want to make sure some my car run good. I said,
Mm-hmm.
exactly what this is like. You are doing the preliminary stuff all the time by putting in gas. You do a little wiper fluid. You wash the car. You take care of all those other things. That's what we do when we eat and we, choose these different lifestyle things. However, at least one time per year, you have to take the car in to whether it be a real mechanic or a little guy that you go on the side or whatever, but you have to make sure that you are getting a comprehensive analysis to make sure that that car is not going to leave you on the road. It's
Mm-hmm.
the same thing with your body. Do not take it for granted that this
Exactly.
body that used to be nice and 20 and the knees were kneeing and the back was backing, right? And doing what it was supposed to do, that
Right.
is going to continue on the things that you were doing in
Absolutely not.
your 30s. You are going to have to go and have this thing checked out more often than not. And for some
Right.
of us, we might need to go there twice a year because
Yes.
there are some things on board that cause us to have to go more often than the other person who might just need a one-time checkup,
Mm-hmm.
Right.
per year.
Mhm.
So that is what I realize that is lacking in our culture. It's the education that you don't have to wait until you get sick. And then I recall someone saying, I don't want to go to the doctor because every time I go, someone is dying. Well,
And it's bad news you're getting.
you've waited so long
Mm-hmm.
until the disease process has been so far gone. And
Yeah.
Right.
problem, you didn't do the maintenance every year for 50 years. What did you
Mhm.
think was going to happen? The
Mm-hmm.
oils
Okay.
were not
Okay.
working.
That. I'm sorry, just interjecting slightly.
Yeah.
What age? At what age?
Sharon, I suggest you kind of lean into your device because you're sounding a little muffled.
I'm sorry. I'm using my earbuds.
Oh,
I was
Okay.
just asking at what age because I went to get mine last month, and just by having a conversation, I asked, and no, I was having a conversation with my daughter, who's in her late 30s, and she
Mhm.
has never had one. And I
Okay.
was appalled, and I said, "But wait, how come?" And she said, "Well, the doctor says not until she's 40."
mm-hmm.
Exactly. And that depends. So let's talk
Oh,
about that. So the
oh,
average age, depending on the authority. So US Preventative Task Force Services is one of the authority. American Cancer Society is another authority. Both of those sort of agree. And then you have American College of Obstetricians and Gynecologists. They sometimes can vary with their recommendations. So those three bodies are the governing ones that sort of tell people what to do. And of course, CDC comes into this. Many of these guidelines that come out, they will say at least start having a conversation with your healthcare provider by the age of 40. If you are a woman of average risk, and I have to say that, if
Okay.
you are a woman of average risk. So what does that mean? A woman of average risk means that you do not have a first degree relative with a history of cancer. You also do not have a personal history of cancer, any type of gynecological cancers. So you didn't have ovarian cancer, you didn't have cervical cancer, you didn't have any other type of cancer in your family from a sister, from a mother, right? So you are a woman of average risk. This changes though if you are a woman of a high risk family. And so, if your mother was diagnosed with breast cancer and she was 30, we are saying to you 5 years before your mommy's diagnosis, you need to come in. So, you might
Mhm.
find a 25-year-old on your table getting a mammogram.
My
Or,
my I say something. I'm so sorry. Um, like on my husband's side, my husband's sister-in-law. Please follow me. It's a little complicated. My husband's sister-in-law's mother. She was a woman in her 70s. It was discovered that she had breast cancer. So her daughter decided, okay, let me go down. She had retired, went to Florida to live for years. The daughter decided, okay, I'm gonna go take care of mom. But because she's diabetic, she went to the doctor primarily just to get meds, to tide her over for an extended stay. Somehow found out she had breast cancer, so she ended up, going into treatment and all of that stuff. But she has three daughters. So then they, for whatever reason, I guess because it was the type of cancer, they decided, okay, all three should be checked. And what do you know?
absolutely, they should be checked and
Yes.
should be checked
And the
for
youngest one,
genetic.
the youngest daughter was born in the 30s.
Say that again. I can't hear you.
Yeah,
Repeat.
go ahead now.
Okay, I'm saying they should be checked for sure, and they should be
Yes,
checked for the genetic type of breast cancer. So these
that's
are
what it was.
who I would say one, BRCA1,
Hmm.
BRCA2 genetic testing for sure. Secondly, I would want to advise them to go and seek genetic counseling. So I
Medical.
would put them in to see a genetic counselor right away because
So
not
they
only
did, they did all that. Yeah, they did all that. And the younger daughter, hers was imminent, or it was just coming in, or whatever. And they advised her to do a double
okay.
mastectomy because it
And
was
let me just say this before you interject. They are not just at risk for breast cancer, but they're also at risk for ovarian cancer, which is a very
wow,
insidious type of cancer. This is one where you don't really have a lot of symptoms that you can even recognize. It's what Maxine said earlier, drink little tea, a gas. It comes on like the abdominal distension,
Mm-hmm.
a little bit of gas and bloating sort of discomfort. But most times that's already in the latter stages of ovarian cancer.
Oh.
So many persons don't even know that this is what is going on. But when you are at risk for those genetic type of breast cancers, that has to also be considered. Another thing that I have to say, for these women, the Ashkenazi Jewish women, they are also at risk for the BRCA1, BRCA2 genes. I see these all the time in practice. We encourage these women, have your babies the minute you can have a baby, because your lifespan for obstetrics is this long. And
wow,
the reason for that is
Yes.
you're probably going to have the double mastectomy. You are also probably going to have some form of hysterectomy and bilateral ovarian removal as well.
Mm-hmm.
So you are losing your fertility much earlier
Earlier.
than the average
Mhm.
woman who is
Mm-hmm.
of average risk. Does that make sense? So
Yes.
that's why I'm
Yeah.
saying to you, the high risk woman, her treatment plan and her advice that should be given is much different from when I say to a woman of average risk, yes, let's have a conversation at 40. You can start, but you could also start at 45 for a mammogram.
Mm-hmm.
High risk woman is a woman that makes me nervous, to be honest with you, because this is a woman who she looks great. She's in the prime of her life.
Mm-hmm.
Could also be 20 or 25 years old.
Mm-hmm.
This is where
Wow.
you hear of these horror stories of a 21-year-old who comes in and she only had 6 months or 3 months. That
Wow.
kind of a situation.
Oh
The
wow.
cancer is aggressive. It's most times like a triple negative breast cancer, very aggressive. It's one of those inflammatory breast cancers. It doesn't give much warning. It's here and then
And it.
they're not here.
Oh
Very,
boy.
very, very.
Okay, I have a question.
Yeah.
I have a question for you, Dr. Renee. Okay, so does the type of bra that we wear has an effect on our breasts?
It has an effect on the architecture of the breast, but in terms of causing cancer, not.
Mm-hmm.
No.
And the reason for that, because I am really very big. I'm a H cup. And I can't wear bra without the wire.
Hmm.
I have to wear, my bra has to have the wire underneath for the support.
Hmm.
Because anything else doesn't work for me. And
Mm-hmm.
I've heard before that the wire has, could have an effect on you, because sometimes they start poking you, squeezing you, and
In
that
that
hardness
case,
underneath the breast.
in
And
that
that's why I
case,
asked the question.
in that case, if it's a part where the wire is causing any type of friction against the skin, that can cause skin breakdown in any area. It could cause skin breakdown on the abdomen where it's resting or along the
Right.
breast wall, of course. In that case, yes, but it's not a breast cancer. Breast cancer, remember, cancer is an abnormal proliferation of cells. This is
Mm-hmm.
not a
Right.
health thing.
Right.
This is a physical thing that is happening against your skin. So, yes, skin breakdown, integrity of the skin, yes, but not cells from the inside that is cancerous in that sense. No.
Mm-hmm.
Okay. Thank
Mm-hmm.
you.
Mm-hmm.
Yeah. So back to your question, Shernette. Your daughter at mid 30s. This is where, if she's of average risk, she is now thinking by the time she's 40, she's discussing with her primary care provider, am I a candidate to just have a mammogram then at the age of 40? It is a shared decision making process. It's
Uh-huh.
not saying mandatory that you have to. She can do it up to age 45. She can wait if she wanted to.
Oh,
However, there was a couple of years ago some changes, and none of us were happy with this. I've been in women's health for 18 years. I look a little bit young, but I'm not. But we were not happy with the fact that women were told to no longer do self breast examinations. Our recommendations were do your exams at least one time per month outside of the menstrual cycle so that you can get a feel for what normal breast tissue feels like. We
Mm-hmm.
wanted women and men
Mm-hmm.
to be familiar with
Mm-hmm.
what normal architecture felt like for their own breast tissue. Because what we did not want is that when abnormal came, women were panicking so bad that, they didn't really know. So if you
Mm-hmm.
knew what normal was and your baseline was normal, then if and when abnormal came, this is definitely something I got to check out because
Check out.
that.
Mm-hmm.
Exactly. And no one knows your body better than you do.
So
Nobody knows it.
Absolutely.
told us a
Yeah.
few years ago, yeah, get rid of the breast self exam because it had women coming in unnecessarily.
Mm-hmm.
Oh, it made us nervous. I know some people may have been okay. I know I was one of those persons who were not okay because I was always empowering women and men to do these exams.
Mm-hmm.
And so when people stopped sort of doing these exams, I felt like it was tough. And then COVID hit,
Mhm.
and people weren't coming to the office
Right.
anymore to do these exams. And then when after COVID, when people were rushing back,
Mm.
findings were rough
Yeah.
on
Mm.
us. Yeah.
Mm-hmm.
But I mean,
But
Okay,
m-
so
may I,
Go ahead. Sorry.
go ahead, Max.
Who was
all
it?
right, so it is said that men too can get breast cancer. How do they do mammogram on a man? How is mammogram done on
So
men?
it's not
'Cause,
necessarily a
I mean,
mammogram. They can do an ultrasound and an MRI. So
Mm.
it's a type
okay,
of imaging, but it's not necessarily a
okay,
mammogram. Of course, for men with larger breast tissue, in the case of
Right.
gynecomastia,
Gynecomastia.
you may, but that's not necessary. But you can do the MRI and you can do ultrasounds. Those are going to be very, very accurate. And you would use both modalities. And in that case, you'll be able to tell. There's
Mm-hmm.
also like
It-
fine needle aspiration biopsy guided by ultrasound, where with the biopsy, they're able to take samples of those cells, test those cells, and they're going to be able to tell based on the differentiation of those cells, is this cancerous? Is this normal breast tissue?
Hmm.
Yeah,
Mm-hmm.
that's what.
Okay.
is okay? Question part two to the same question. Is it also recommended that men do yearly testing for breast cancer, or is it
No,
just women
not
that
the
needs to do
same
that?
guidelines for men, but I usually will say to a man, you also want to see what is your normal architecture. What looks
Okay.
normal for you? So when they come into the office and I've asked them, when was the last time you did a breast exam? I get the sides there, the bombastic side.
I'm sure you would.
Girl, you play with my
I'm
manhood.
sure you would.
But it's crazy. So what
Yes.
I've done with the annual visits, I have actually taught men how to do the breast exam. And it's not
Okay.
a demasculinating thing. I'm not trying to take away your manhood. I'm actually reaffirming you in the sense that I want you to be whole, I want you to be healthy, and I want you to have the opportunity to know that just like Montel Jordan came out and said, I
Mm.
had breast cancer,
Mm.
can happen to any man. My friend's
Mhm.
dad had triple negative breast cancer. My friend had triple negative breast cancer. So this is not a foreign thing. I'm talking about people that I've physically touched, right?
Right.
Hmm.
It's not a
Mm-hmm.
story I've heard. These are physical persons I know. So we start off under the
Okay.
armpits because that's where the tail of Spence or the tail of the breast tissue is. And I show them how to go up and down and stopping at the chest wall because that's where a lot of little tiny, masses can kind of hide. And they're
Mm-hmm.
like, oh, nobody never really do all of this, And I said, listen, get wifey to feel you up. And when you kind of put it like that, they like that part.
Exactly.
When you have to tweak it a little bit, it can't always be so medical. You have to kind of, it sounds bad, but you have to
Yeah.
kind of sexy up the thing for them. Because they prefer
Especially for
that.
our men, if you sexy it up,
Yes.
that's how
You
they get
sexy
it.
it up, you
Yeah.
gather them a little bit better
Our
and you're able
Jamaican
to
men.
relate a little better with them. But you're not trying to make it where it's uncomfortable, by being
Right.
sexy, but you toe the
Mhm.
line a little bit. And of course, you're reading your
Right.
audience.
Right. Mm-hmm.
You know,
Right.
I'm that girl where you go in your room and you see what's in your room and you just flow,
Yes.
right?
Mm-hmm.
So
Mm-hmm.
60-odd-year-old guy in coming in and have ED issues. So all right, so you want to make sure I'm comfortable and this can happen. But let's talk about this part. And you just flow
Yes.
accordingly, but you
Yeah.
want to show.
Right.
Okay, so these are the normal things. The nipple can be flat or it
Hmm.
can be pushed out. It should never be sucked in or everted. If that is
Right.
an
Right.
in,
That's
I
a
need
that's a
you to
sign.
come back. I want you to come back and show me that so I can take a look at it and I'll have to send you for diagnostic testing. The next thing, the breast tissue, man and woman, should be nice and smooth. Girl, your skin nice and smooth and clean, like baby bottom, right?
Mm-hmm.
Otherwise, it looks like the peel of an orange or a grapefruit. Girl, we have a problem.
Mm.
Yeah,
You're
I've heard
squeezing
that before.
nipple during intimacy or any other time or during your examination. And one, you're not breastfeeding, you're not lactating, there's no baby or man, Lord Jesus, that was a new thing. Sucking on the nipple, you shouldn't be lactating.
Right.
Could be a sign of an issue. There could be a pituitary tumor, and if there's blood or pus, that's another problem. So I need you to
Wow.
office right away. So, like I said, if I've given you baseline for all this time, and then these new findings start happening, that's
Mm-hmm.
a problem, right?
I'm so glad you mentioned that, doctor,
Yeah.
about the fluids coming from the breast. Because I told the story before. My sister was even on the program when she shared her experience living in Jamaica, and she started seeing the same fluids and bloody water and like milk and blood coming out of her breast. And she went to the doctor, and the doctor just told her that it's because she just had a baby not long ago. Why that? So she should go home. But she was so uncomfortable with it because there were tenderness and all of that. She demanded and begged for a mammogram, for some
Second
advance,
opinion.
and a second opinion. And it was the same thing. So she left there, came here. Long story short, she came here for vacation, and we told her to come back. When she told us the story, my brother had her come back. We took her to the doctor here. She was stage 2 cancer.
Yeah.
And but she
Wow.
had already made up her mind that regardless of what it was in one breast, but she made up her mind to do a double mastectomy,
Wow.
regardless of what, and that's what she did
Yeah.
because it was life over breast at this
Mm-hmm.
point. So
So here is a
that
question.
was
Here's a question
interesting.
from Charlesy. My question is for the doctor. You do your mammogram, and the doctor said you have some scattered fatty tissue in the breast. What should you pay attention to?
To be honest, the fatty tissue is not an issue. It's subcutaneous fat, and that can be there for a lot of persons. What you want to feel for, it's usually going to feel like a lump that is firm, it is fixed, meaning it is
Fixed.
not moving.
Mm-hmm.
Literally firm and fixed. It's attached to the wall. Sometimes you're not able to feel it too well, but you will probably see some of the other changes that I just mentioned. So when you're doing the examination, you might feel it a little bit bigger than what you anticipated, right? So firm, fixed, immobile, problem.
Mm-hmm.
Yes.
Lump,
We learned that in school. Yes.
potential problem, because the lump can be cyst, or it could also be a problematic issue, right?
Mm-hmm.
So
Right.
those are issues that I'd rather you just come in 10 times and me give you 10 opportunities to reassure you than just you sitting at home saying, well, should it say this or should it say that. So that is what I would much rather. If the peel orange,
Absolutely.
you definitely want to come in. If the blood
Yes.
or the pus or any of those things, you definitely want to come in.
Right.
Retracted nipple or pulled in nipple, new finding, you definitely want to come in. So those are some of the things that for sure. Another thing, woman has a baby. Everybody know, you get this engorgement and potential mastitis that
Mm-hmm.
happens after, delivery. And with the mastitis comes a fever. It's usually caused by a bacteria on the skin,
Mm-hmm.
Staph aureus, and you treat it with
Staff or
antibiotics.
yes.
Goes away, hopefully, after like a few days. Issue is there is a breast cancer that similarly mimics that mastitis. It's an inflammatory breast cancer, which is the one that is the most aggressive kind. Now, if I have treated you for this mastitis, or what I suspected to be mastitis, and then within days this thing just doesn't go away, you better come back, Because in my differential or in my alternate diagnosis, that needs to be something I'm thinking about as well. Not because you just had a baby means that this can't be something else. So
Mhm.
that's one thing I want women to be paying attention to.
And there, as I had mentioned, there are certain myths. So we need you to tell us if there are facts, like processing of the hair, if the chemicals have anything to do with women getting breast cancer, because that's something that
So that's a big one.
we've
I want
heard.
to say this first and foremost. It hasn't been finally proven. However, cancers can be caused based on our genetics and based on our interactions with environmental factors. So let's say
Lifestyle, yeah.
the environmental factors, including the chemicals for our hair, including the foods that we consume, the beverages that go into our bodies, all of those things can contribute to breast cancer. So while I can't come out and explicitly say, yes, TCB, give me cancer, yes, it could be and then cause an outright lawsuit upon Dykal, right? I will
Yeah.
say that cancers are caused by an interaction between the individual, their genetics, and also the environment. It's a complex interaction. So it is very, very possible.
Hmm.
Allegedly.
Okay.
Also, another one, Lady D. Another one
Uh-huh.
is Max mentioned the bra. I heard somebody say if you wear dirty bra, if your bra is dirty, because we sweat there in that region, and if you wear dirty bra, it can contribute
I
to
mean, it's
breast cancer.
environment again,
It's environment again, right?
while not completely proven, could be anecdotal, right?
Hmm.
Again, environment,
Environment.
complex interaction, genetics with the individual. Can be
Yes.
Yes.
possible, very possible.
So may I
Hmm.
also
Yeah, they
share?
mentioned black bra as well. Somebody had said that if you shouldn't
Oh,
wear black bra. Yeah,
Merciful.
even the
also,
color is an issue.
I mean, can we just like not
I know,
exist?
right?
This is
Yeah.
crazy.
So the first time I became more aware of um, a younger person in their 20s being diagnosed with breast cancer was a young woman I was introduced to several years ago, and I had the interview with her on my radio program. And she happened to just be laying down, and her hand just passed over, just, and she felt this thing, and she was only 25 at the
Wow.
time. So when she felt it, she went into the doctor and so on, and she got the diagnosis and went through her treatments and so on. A very resilient young woman. She
Mhm.
later went on to study her communications and doing very well. She's a Native American. But after she explained how frightening it was for her, because she's only 25, she couldn't believe
Wow.
Mhm.
that she was actually diagnosed with breast cancer. So, what I've also observed is that um, at the hospital where I go to do mine, what they do now, they do the mammogram and then they do the sonogram, and they don't bother wait. They just
Wow.
say, let's just look, in case,
Yeah,
because some of
yeah.
us, like myself, have very dense
Sense.
breasts.
Mhm.
Right.
Mhm.
So it's the mammogram might not pick up something, but the
Yes.
Everything, yeah.
sonogram, yes, but the
Yeah.
sonogram does,
And
Yeah,
another
I
thing
know
in that
somebody.
oh, go ahead, go ahead.
I know somebody who went for a routine mammo as well because she was doing self examination, and hers were very lumpy, just lumpy all over.
Mhm.
I think it may have been a skin texture issue, like Dr. Renee spoke about earlier. But
Mm-hmm.
she said the doctor told her, I mean, after questioning her, about her habits and whatever, she was told to stop drinking Coca-Cola. So she drank tons of Coca-Cola.
Oh boy.
And she was told to stop drinking so much. And she stopped and it cleared right up.
So she
Oh.
had polycystic breast disease, is what happened, or what?
Apparently, yeah.
And a lot of young women do. In my early 20s, I had a few mammograms because I had polycystic breast disease.
Me
It's
too. 'Cause
very
I have a
painful.
marker right now. I have a
Yeah.
marker in my left side right now because I have very
Yeah,
lumpy
it's very,
polycystic.
very painful. And it's these cysts, they come and go. But
Mm-hmm.
cysts tend to look very different on ultrasounds versus an actual mass that's cancerous,
Okay.
right? So
Mm-hmm.
when you look at cysts that are filled with fluid on an ultrasound, they're going to look black, like fluid looks black on an ultrasound.
Mm-hmm.
So when you
Mm-hmm.
see it, you're like, okay, that's fluid. Because when we
Mm-hmm.
do these ultrasounds, you know. But then when you're seeing a cancerous mass, that's a definite look. You can't miss that one.
Mm-hmm.
Yeah.
And it's interesting, the same the same myth that Max mentioned here is your mom saying that she has heard that wearing black bra can contribute.
Wow.
Yes, I heard that before.
We
These are
didn't know
some
that was
myths.
a
I heard
thing.
that
I
several
didn't know
times.
either.
Yeah.
But speaking of being familiar with your own body, this is something that happened recently in my family right here. And this is not really breast cancer, but to show you how important it is. My mother was here in Miami and she started feeling this little pain underneath her arm. So she was doing work because she was, working with someone and she was doing work. So she thought that she probably lifted something and had a strain. And she kept telling us that she's feeling this pain, but it would go away and then it would come back and it would go away. And she decided, she when she make up her mind, she is like, it's against what we think she should do. But let me tell you, she's always right. She made up her mind. She's leaving this work. She's not doing it. She's going to her yard. She's going to Jamaica. Whatever. She went to Jamaica. She spent nearly a year and then she come back in February.
Mm-hmm.
She was having a little cough, a little cold come back and it was a little chilly here. So I told her, you need to go to the doctor and get a chest x-ray just to make sure you're okay. Doctor did a chest x-ray and when it came back, it's, uh,
Oh, Jack, you
You're breaking up and
froze.
a
freezing.
You
shadow.
froze.
And breaking up.
Yep.
Yeah, she
You're freezing time. You're freezing time, Jackie.
She can't. Okay.
okay, she'll have
Her
to come
internet
back.
is acting up. Yeah.
Yes.
Her internet is acting up.
Let me see. All
She's
right.
coming back.
Oh boy.
Yes. Go ahead. Repeat,
Yeah.
Jackie.
Yeah, I totally lost you guys right now. But anyway, the doctor did not like the little shadow, so she sent her to do a scan and she did a biopsy. And she said what they found was like thyroid cells and it was resting like right here. And
Mm-hmm.
the thyroid doctor got involved and they decided they're going to do a surgery, remove whatever they saw here, remove the thyroid just to make sure because they don't understand why thyroid cells are there. When she went to do that surgery, it was supposed to be like 3 hours, if so much. And this was just in July. The thyroid cells migrated to her fourth rib. And the pain that she was feeling was in her breast.
Oh, wow.
So they had to cut through the breast, take out a whole lot of the breast tissue. Because she told me even that before last night that she used to feel it, but she didn't know what that was. It didn't feel ordinary. And now she knows that that was what she was feeling. They had to take out her fourth rib because her thyroid cells migrated to her fourth rib and started growing over it. They had to cut out the tissue out of her breast and take out the fourth rib and do a reconstruction of the ribs and everything. And nothing is really in her body. It didn't transfer to anywhere else in the body. But just to show you, to
Right.
be familiar with your own body and what is normal from what is not.
Yeah.
And you know,
And
that
so
surgery was 8 hours. It took 8 hours because when we saw 3 hours came and we didn't see her out, I was at school and I started worrying. 5, 6, 7. I called my brother. What is happening? She was in that surgery for 8.5 hours. They had to take out the fourth rib, cut through her breast, one big incision down here, they had to take out a whole lot of breast tissue. And you should see that thing. So the doctor said these tissues can migrate from one place to the next. And it depends on where it shows up. It might behave different. So there you go.
which is why, though we understand the fear of human beings, because we don't want to be told that we are not well. But it is so
Right.
important that we go to the doctor.
Yeah.
You
Yes.
have to go.
Yes.
We can be walking around looking
Absolutely.
good, and something is breaking down on the inside of us. If there's anything I learned from my grandfather, now deceased, Daddy never joke. If Daddy had a pain in his foot, his finger, somewhere,
to the doctor.
he is calling for his cab to take him up to Frankfield, and he's going to see his doctor. Even when my grandmother would say, Lord, Mr. Thomas, you love go a doctor, so in just zoom her out. He is going, people need to understand that
Absolutely.
it's almost like a man who doesn't want to have a prostate done. Granted, now they can do the blood test and so on, right?
Yes,
But
a PSA.
if you are insisting that me now go do none,
Yeah.
when you get diagnosed, everybody now get caught up
Right.
Into
into
it.
this
Yes.
thing.
That's what's important.
Yeah.
Exactly.
Yeah, that's when your problem
that's
becomes
the part
everybody's problem.
I don't know if I'm to say it's selfishness. I know it's fear.
Yes.
Yes.
Fear.
I personally know people who have not gone to the doctor in 30 years.
Yeah. Jeez.
I'm telling you
Yeah.
that.
Wow.
Thank God they have
Are you
maintained pretty
kidding
good
me?
health, but things are breaking down.
But you
You
know,
know?
Yeah.
but you know what, ladies? It's our culture too, because when I was growing up as a little girl, nobody in my family or in the district went to the doctor unless they were dying. And I mean dying. You had to be dying for you to see a doctor. Because everything, there was a bush for everything. There was a Sorrow City fever grass, the mint, the water view for everything. So we
Because
grew
of
up with
maintenance.
that.
I don't know.
We grew
Yeah,
up
but
we
also
grew
we
up
have
with
to
that
remember,
culture.
people in general
Sorry.
sometimes really afford, that checkup when they consider other things that need to be done and the resources, financial resources that they have, and as long as they're not feeling any pain, they just decide, look, let me just ask the good Lord to keep me, and me just keep going.
Yeah.
Because like
That's true, but even when there was pain, there were times. Because let me tell you something. I am a family member in my family who suffered because of I would say ignorance, maybe ignorance or whatever. I had a ruptured appendicitis. I started having pain on my side one
Oh.
Sunday morning. Never forget. I was
Wow.
only 10 years old. I was only 10 years old, and my grandmother said I was washing plate outside. And she said, "Go lie down." And for the rest of the day, I had fever. I couldn't eat. I was vomiting, and it got so bad I could hardly walk. The pain was so severe. And my mother, because my grandmother was an England, and she had to go to Kingston the following day to sell her stuff. So she asked my mother to take me to the doctor. And I went to the doctor, and I was sitting in the doctor's surgery all day, roasting with fever before I got through, because that's why I had to go to the doctor. In the surgery, not the emergency room, the doctor's surgery. And that was when I was diagnosed. And I got admitted same time. And the following day, I had to have surgery the following
No,
morning.
you're lucky you
And
live.
they discovered, yes, but they discovered then that the appendicitis was ruptured. So I ended
Yeah.
up getting
God.
2 incisions.
That's
Yes,
poison.
I was only 10. I got 2 incisions, one in the center of my stomach and one to the side, because they had to put a tube in to drain it.
wow.
So, we
That's
yes,
poison.
because back then they just sit around it. When you feel sick, they give you some minty and tell you to go lie down and you 2 Panadol, and nobody
We
saw
know
any
that.
urgency.
We
Doctor,
know that.
So
say
if with all
something,
of
the
that,
doctor. You
Yeah.
hear
I
almost
know.
never know.
So with
Almost
all of
never
that,
know Max.
Yeah.
You see that?
that's what
We
I'm
Right.
almost
talking
never
about.
age. We
So
almost never know
Yeah.
Max. No,
exactly.
sir.
So with all of that,
Preventable.
my husband know, my
Lord.
husband now thinks I'm crazy because the moment I feel any little thing, I'm out of here to the doctor. First, let me start ball. That's the first thing me
Oh,
start shed tears, and I'm in the emergency room because I'm not taking nothing for granted.
Yes.
I live very close to the hospital.
And the challenge is for us, sometimes pain is the
Oh
last
my
thing
goodness.
a lot of persons feel in these
Okay.
chronic,
That's
in
true.
these types of conditions. The pain is the last thing. So when you start feeling pain, it's not really the first thing. You're already so far gone when you're feeling the pain in a
Yes,
lot of
Yeah.
conditions. That's the problem. You know, you are there with other little signs that we're saying, red light, warning, warning,
yes.
warning. And now the pain is here, and you're like, okay, I mean, what do you want me to do for you today? You got
Yes.
wow.
to live.
And we know that the mammogram is a bit to do the mammogram.
It's uncomfortable.
It is uncomfortable,
Yeah.
right?
So what
The
I
last
ask,
Very. I hate it.
Dr. Renee, the last time I went, the woman took the breast and she pulled,
Right.
and I'm
yeah,
pressing in based on her
Lord.
instruction. But me
right,
understand they need to capture the image right,
right.
Yeah.
right?
There
So
is an
if it,
option that a
yeah,
lot of persons don't know. So it's not offered everywhere, but there is an option to ask for a topical lidocaine, not prior to going in, but when you get there. Some facilities do offer this. The topical lidocaine can be applied by the technician prior to actually doing the mammogram. Because it is topical, it's not going to take away a whole lot of pain, but it certainly makes it a little bit more tolerable.
Easier.
Of course, they
Hmm.
tell you no perfumes, no deodorant, and so on. So you're
yes.
not going to apply anything prior to going in, but they can do something there for you about at least 20 to 30 minutes prior to the procedure. That will help to take away the discomfort of it. It certainly helps. Another thing that I like to say to women, if you're going to a certain location to have your mammogram done, stop hopping and skipping and jumping from place to place unless you
Mhm.
are able to get your records, because you want to try to find a location where you can maintain consistency in your records.
Absolutely.
People
Yes.
go here, there, and everywhere. And then if something was found in place A, they don't have a record of getting it. And then, oh, yeah, I don't even remember. Yeah, they said they saw something. What does that even mean?
Bean,
If
yes.
you maintain consistency in the locations where you are going to, or maintain good records for your health, then that is going to be very helpful for the next person who has to follow up behind somebody 1 to 2 to 3 to 5 years later,
Hmm.
right? Because
Hmm.
sometimes when you
Very
come to us
important.
and we're looking, it says no history to compare, no previous scans to compare. And then no, I don't know if this is really a big problem that has been followed for 10 years, or if this is a real thing that really needs to be addressed immediately. You know what I'm saying?
Hmm.
So that's another
Yes.
thing that I tell women for their mammograms as well.
Right.
Yeah.
So,
Yes.
do you
I
have
did
an?
that when I relocated from, sorry,
Go ahead, Max.
I would say when I relocated from New York to Georgia, I got my all of my medical records, including my mammograms, transferred here because, of course, it's
Yes.
important, as
Yeah.
Dr. Renee said. So have records of your history. History is very important. I do get my mammogram every year, and I go to the same facility every year. So I
Absolutely.
know the importance of that. Yes.
Yeah.
So, Dr. Renee, do you have any stats for us?
You know what is crazy? Breast cancer is really a disease that impacts older women. And what we are seeing now is that with people becoming more aware, the incidences have actually decreased
Hmm.
over the past few years.
Okay.
However, I will say this, and I might get stoned off this program. The disparities still exist for access. The disparities are still there that
Oh
exist
yes.
for access. So
Hmm.
as
Oh
much as
yes.
want to say yes, early detection can save a life.
Yes.
Access to the care is just not there.
Mm-hmm.
The
Yes.
availability and the affordability of the care is just not there.
Not there.
So while I could,
So
speak
when
on
you
this,
said older women,
older women, usually women
sorry, I
over
was
the
about
age
to ask. You said
The
usually
age of
I didn't
what?
hear that. You broke up.
5, women over the age of 65.
Oh, over
Mm-hmm.
Okay.
65. Okay.
Yes.
Mm.
Yeah.
That's where
Yeah.
we would normally see it. Majority of the cases were women over the age of 65, but clearly, that's not always the case. You're seeing younger and younger women
Yes.
happen.
Yes.
Because again, what are the risk factors? Risk
Mm-hmm.
factors are environmental, it's obesity,
Right.
it's
Mhm.
lifestyle, it's
Mhm.
your genetics, it's
Right.
did you have a lot of chest x-rays as a child, right? Did you get your first period very early? Did you enter into menopause later? So many of these things are the traditional risk factors. But
Yeah.
again, it's a complex interaction between the individual, their genetics, and the environment. That's pretty much what is causing it.
And it's
Mhm.
interesting that you said that because there's a friend of mine, her mom lives in Jamaica, and she has been coming back and forth. And then she just happened to ask her mother when, when was the last time she had a mammogram done or a physical, and her mother said, "Me not do any."
Oh wow.
And
Yes. Tough.
she was
Tough.
she was thrown. She got on it right away. Thankfully, there's nothing seriously wrong with her mother, but she was she couldn't believe because
She couldn't
one,
believe,
she
right?
she never had that conversation because she just assumed that her mother goes to the doctor.
Mhm.
So
Mm-hmm.
And
yes.
that's why when we are educated and informed, we have to be in touch with those who are not, especially
Yeah.
our family members, because older people tend to relax and if they have a little pain and drink some tea, say a guess. So
Mhm.
we know that now that we are more informed and more educated and have more experience, we have to pass this on. We have to check on our mothers and grandmothers and sisters and brothers too,
Yeah.
to
Yes.
ensure that they do what they need to do because their problem becomes
Yes.
our problem
I
Hmm.
don't know
at
if
all
my
times.
dad, I don't know if my dad is watching, and I'll use him as a prime example. So I was in New York in June, and as a big primary care provider, and priding myself on helping people with the weight loss and dropping people from double digit A1Cs down to like 5, and very excited about our program, and people doing all these things. And so he says to me, Renz, can we go over a couple of things with my health and so on? I was like, oh, perfect. When your parents come to you and so on, it's always a pleasure, right? So I was like, all right, so
Right.
what's the latest A1C? How's the PSA? And I'm going over stuff. And he's like, yeah, the A1C, I beat my bad. I think the last one was 13. I almost fell off the chair. This is
Sure.
I almost died. I said, listen to me. I thought I was going to pass out. I called my husband. I was bawling. I failed him. I literally was failing at life because here I was. I was focused
Helping everybody else, huh?
on life,
Yes.
work. I was living in California for the past 8 years, and we had just come back home, and we were just so focused on
Hmm.
living, right? That our parents are aging, and they're fine, they're fine. They're up and they're mobile, and they're doing their thing. They are still able to take themselves to the doctor. They're independent.
Right.
Mm-hmm.
For
Right.
did I possibly think that? I wonder if he's having any challenges with any aspect of his health that he might need some assistance with. Never for a minute did
Hmm.
I think about it. And I'm telling you, it was
She nearly jump off the chair.
send me
Yeah.
back down.
Oh
You
my
you hear the
goodness.
pronouns. You hear the pronouns. Listen to me.
Yeah.
I read neurology this morning.
Yeah.
I was really, really hurt.
Oh my gosh.
I was disappointed in just not focusing because I was just living just trying to live my life, trying to figure out life, doing life for myself, that I just have
Mhm.
just neglect what was happening in
Yes.
my own family.
But
It wasn't intentional. Definitely wasn't intentional. But I'm
if
happy that he brought it up and said, "Hey, can we have a conversation?"
Mm-hmm.
So that brings me to
wow,
the next
Absolutely.
point. Can we sit
wow,
and have a conversation with one family member today? Can we
Mm-hmm.
sit and have a conversation about end of life care with one family member, whether it be a mother, a father, but someone that we care about? Because what has been happening
Mhm.
is that a lot of our family members are coming to that end of the road and we have no clue about what they want, no
Yes.
clue about their
true,
Yeah,
desires. We
true.
don't
yeah.
know.
True.
Have a will? Do you have a living will? Where do you want to be buried? Which song
Mm-hmm.
you want to sing? Which part of
Mm-hmm.
clothes you want to put it in?
Your power of attorney,
Life insurance,
you know.
right? Any of
So
those things.
yeah,
So at least I can do right by you, right? You've
Yeah.
done right
Yeah.
by everybody your entire life.
your
And here you
consent
are.
decision. Who's
Let's
that gonna make that decision for you if
know.
you're not able to? If you're at the hospital and you can't talk, you're in a coma, so who's gonna make that decision for you? Those
Yeah.
are important things.
Mhm.
And my decision about you may not necessarily be the decision you're going to make for yourself.
Right.
And I learned
Right.
this the hard way because I'm an organ donor per choice. I have said this to my husband, and him said, "No, no, you're not doing it." So I've had to go to another family member who have a little bit more sense, and say to her, Dr. Aniki,
My
I would
husband beat
like
you up.
for you to know that I am an organ donor and I do want to donate my organs if anything ever happens to me.
Mm-hmm.
My
Renee,
truth about that is, I think my
That's
organs
another
are fine, but I
thing.
decided not to put that on my driver's license because when I think about it, I say to myself, maybe if something happened to me, they're not gonna fight as hard for me
you
to
know
take
what?
care of me,
I don't
for
know.
me to live. I always say that. That's why I
I
didn't
don't
put it
know.
on it.
I don't know. I
Well,
would
I don't
hope
put
that
that on
if
mine
I'm in
either.
a position, they will, but I don't know. But one way or the other, this is my choice. And then
Mm-hmm.
even recently, I was having the conversation with my husband, and he said, "Babe, I don't want to be a vegetable. I don't want this life prolonging measures that, if it's not going to work, I want you to be okay to let me go." And
Mm-hmm.
just like how I said I want to be an organ donor, I said, "No, brother, you're not left." Both of us were on the same page. And this is why you sit and have the conversations now.
Yeah,
So you
yes.
can iron out the parts
Right.
that you're not so comfortable with.
Yeah,
Mm-hmm.
even
Yeah.
a
Yeah.
simple
The
DNR when you're in the
DNRs,
hospital. DNR.
the DNRs
Yeah.
and the DNIs and all of
Yes.
these terminology that you may not
Yeah, do
understand.
not
And they're
resuscitate, do not
Do
causing
not
intubate.
intubate.
the breast
Yes.
cancer. Sometimes it is not one that is going to work out. Let's just be clear. It's not all the time you're going to get a remission.
Mm-hmm.
Sometimes it's just the end of the
Yes.
road for
Yes.
someone.
Yeah. Yeah.
So
Yeah.
when you're talking
Ye-
about that, if someone is coming home, do they want hospice care? Do they want palliative care? What is
Mm-hmm.
the difference?
Mm-hmm.
Do you want to be in palliative care where it's you have greater than 6 months to live? Is this hospice where, boy, you have way less than that? And if so, do you want in-home hospice or do you want a hospital-based hospice? What
Mm-hmm.
does
Yeah.
that look like? So those are some of the conversations you want to be having and having those very, very early. Because
Yes.
Yeah.
in the middle of that, the decisions are not going to be firing off like that easily. And
Mm-hmm.
when healthcare workers come and ask you, you're going to think we're the worst persons on the face of the
Yeah.
earth. How dare you ask what you
Yes.
want me to do with your parents' organs? This is not the time. And it might not
Yeah.
be. It's a
But it is
critical.
necessary. So let me ask you, let's go back to the breast per se. Now, if a woman has to remove a breast, psychologically, what's the conversation with her?
That is a good one. I'm so glad you brought that up. Have a young lady I spoke with. She's in her 50s. She was going in for a procedure to do a double mastectomy. And I called her the night before the procedure and had this very conversation. And she said, Renee, I never thought about that. The physician didn't ask me about how I was going to process that. She said,
Wow.
I and I said, how is your husband feeling? Have you had that conversation with him? She's like, Renee, I never asked him. What do you mean? Like, so she's been married for 20 something years, never asked the husband how he was going to know, relate to her with a
Mm-hmm.
bilateral mastectomy, how
Yeah,
that
so that's a
would
big one.
impact him as
Yeah,
well.
yeah.
I will say this, if it is at all possible and you do have access to care to receive any type of mental health slash
Yeah.
counseling,
Mm-hmm.
would be so imperative. I mean, already I do think that mental health or counseling should be a natural part of what we have, just like how you have a primary care, just like how you have a GYN and a
Ah,
financial advisor, you should also
doctor, that's another day discussion, my dear.
as well. It
I
should be,
mentioned that to somebody, and they say, "After me, no mad."
no, it's not,
What we
it's
make?
not a mad thing. It's so
It's
you
not a mad
get
thing.
mad thing. So if it is at all possible, have that conversation because this
Mm-hmm.
is going to be a life altering,
Yes.
Oh,
life changing.
Yes,
yeah.
It's going to be body image
absolutely.
smart.
Yes. Mm-hmm.
It's going to be, am I enough? Will I
Mm-hmm.
Oh,
ever be
oh
enough?
yeah. Oh
Especially
yeah.
if you have decided that you are not going to go to plastics and
Right.
you're
Mm-hmm.
have extenders and you're not going to have any type of, enhancement done
Mm-hmm.
Mm-hmm.
to have, natural looking breasts again.
Yes.
That
You
is
know what, Dr.
very,
Renee?
very big one.
Um, yeah, we're here talking on this subject, and I'm looking back and I'm remembering years ago when I lived in Jamaica. I worked at the Heart Foundation of Jamaica in Jamaica. I think they were on Oak Road at the time. I worked there for about 2 weeks because I was waiting to be transferred to another. Because the person the man at the time that was the I would say president there, he had another business and I was trying to get a job in the other business, but they had me there for 2 weeks. So I was there learning and watching and see what was going on. So the lady came in for EKG, and she had double mastectomy. And when I saw her, I almost fainted because I
Mm-hmm.
was young. I was young, inexperienced. I didn't know that that was really happening to people. That people were losing their breasts. Women were losing their breasts. I almost fainted. I could not get the picture out of my mind. That night I could not sleep because the whole picture of what I saw would not leave my head. And until this day, it remains up here. So I
Mm-hmm.
can't imagine having to face that, never mind just seeing it.
Mm-hmm.
So I
Mm-hmm.
agree with you that
Yeah.
women or anyone going through that situation should really get counseling because
Yeah.
it affected me
Yeah.
Yes.
so badly just seeing it on a
But yeah,
per
yeah.
totally strange person who
Mm-hmm.
It's
I
And
don't
and
know,
your
never mind
partner
having
should
to
be, if
experience
it's
it.
possible, the partner should accompany you to these
Yes,
counselings, because
absolutely.
they're gonna need it. Because
But
when I look
mm-hmm.
at my sister, daily now, because she has such a strong support system with us around her. She doesn't have a husband, around her. It's us, and she's strong enough that she can undress and don't feel any way. But let me tell you, when you see the folds here, because the
Yes.
doctor left that part, so if she
Just in
wants to
case.
do reconstruction, she has it. And when you see the
Right.
folds and all that, and I said to her one day, I said, they're gonna grow back.
Uh,
And let me tell
Yeah.
you something. We see two little buds start to come up, and there's something them growing. Listen, know something. If this grow back, this is a miracle.
Wow.
Right.
Yeah,
But
But
it's
but
let
ba-
me
a,
tell
but
you, you
based on
need strong
mm-hmm.
support system.
it's
and
a
strong
process.
support system is important,
Yeah.
but
Mhm.
they too need that one-on-one
Yeah.
conversation,
Yeah, they do.
Yeah.
They
because
do.
it's not something that they're just going to say, yeah man, all right, so we have to go take them off, you take them
Mm-hmm.
off,
Yes.
me there
Yeah.
for you. Invariably
no.
you're going to find that that's not the
Yeah.
ideal situation.
Yeah.
Yeah.
And
It's
these
No.
like
Mr.
these
Husband,
they're going to
actually,
need
Yeah, I met her husband in July of this year. We were all in Jamaica, so it has been a year since her surgery, and we were together. I met her and the husband because I didn't even know her. I was asked to just speak to her. And when I met the husband, he came and he introduced himself. He hugged me and he said, "Thank you for thinking about me in a way that nobody else did." Because
Wow.
I was also diagnosed with breast cancer without
Oh.
really being diagnosed with breast cancer. Because I am married to a woman and I am one with my wife. So although
Wow.
I didn't have the lump,
Mhm.
although I am not going through the chemo and the radiation and the physical sense of that removal, I am going through all of it with my wife. I have
Power to
to see
him.
the lines. I have
Yeah.
to see the drains. I have to
Mhm.
hear
Yes.
the
Mm-hmm.
tears and all of that. And he said, "You didn't ask how is this going to impact you?" And had me unpack my emotions that night. I don't
Mhm.
know how I would have gone through that. And
Mhm.
I literally just sat there and allowed him
Yeah.
to talk that night. And he
Mhm.
Yeah.
had a whole lot to say.
Hmm.
She said she never even thought about it for not even a second, and nobody else had asked. But I feel like it's a nurse's thing. You know, a
Mm-hmm.
nurse as a provider is a very different dynamic.
Mm-hmm. Yes.
A nurse, it's like you think about the things in a different way.
Wait.
Where,
Yeah.
boy, I don't think it's a knock to our physician counterparts in any way because they're amazing at what they do. But
Yeah.
sometimes we've spent so much time with our patients that
You
we
know
just
them
look at it
better.
from a different vantage point.
Oh, when me
And
done.
so
Yeah.
if we both
When
know
me
the
no,
duality
keep it
of
out
that,
there. Me
yeah,
soon
it
finish.
difference.
Thanks.
So
Me
That's
wait a
why
minute.
that's why the nurse's diagnosis is completely different from the doctor's medical diagnosis because we can see things differently, see things that they don't see. We can become attached to the patient, yeah, which we probably shouldn't. But that little attachment for even a short period of time gives
Mhm.
you enough time to probably even save somebody from even from suicide or
And that's
even
why it
from
needs to be collaborative, right? It's
yes.
Yes.
not a fight. It is a
No.
collaborative effort. It's
Mhm.
one person at the center, that patient, and
Hmm.
The
everything needs
patient.
to be a collaborative effort. It's not a fight.
Absolutely.
Yeah, but Lady D, that was an amazing thing
Yeah.
because my friend was diagnosed at the age of 32 or 33. She had triple negative breast cancer, like I said. She removed one, and I remember her sending me a picture, and she said, "This is what I look like now." She's one of the most
Mhm.
beautiful persons I've ever seen. She has the
Mhm.
nice long, she had, nice big afro, and when she straightens the hair, it's nice long hair. She had to shave the entire head, so she was bald
Oh, yeah,
and
that's
Mhm.
yeah.
freshly shaven, right? And she has this breast,
Hmm.
and then this part was flat with the lines, and she showed everything just raw. You know,
Mhm.
one thing, okay, it's one
It's
thing to
okay.
Oh,
look at it in the medical
That's
book,
perfectly normal. That's okay.
one thing to look at it in the medical books, and you're studying,
I see it. Yep.
and you just scroll through the pages.
Mhm.
Mm.
But it's
Yes.
a completely different thing when it's someone that you
Yeah.
Yeah. When you
know
actually see it.
and
Yes, when you know the person,
Yeah.
it's different.
Sometimes.
Yeah.
Yeah, I've had in my family, I've had cousins, in-law who had double mastectomy. She opted for reconstruction, and a cousin of mine had
Yeah.
one, and
Sometimes
she
I.
opted not to reconstruct. So she wears, and she's an age couple like that. So she has like special
Yeah.
bras to accommodate the missing side,
yeah.
while
Mhm.
Right.
her sister opted to do reconstruction.
Mhm.
And on my husband's side too, his nieces, because like I mentioned them earlier, they were young ladies. The youngest was 30 something. They were all, well, one thing was
Wow.
40, other two was in their 30s, and they all had to do double mastectomies,
Wow.
and they asked for reconstruction because they're young women, to carry to be able to have a good posture and feel good about yourself and the other things that come with that.
Yes. And in keeping with that too, while there is the recommended age or ages to do it, here is Vera asking what's the age limit?
Yeah, so it can go up to age 75, but to be honest, again, it has to be a shared decision making process. Depends on what your history looked like. Are you one of those
Right.
persons of average risk? Persons of average risk, 40 to 75. Everything had looked good, then you can discontinue at 75. If you were one of those high risk women who had multiple things going on and this was happening, that was happening, you might be somebody getting screenings and mammograms and MRIs long after.
Hmm.
So that's a loaded question, but it depends on which risk stratification you fall into.
Well, it's 27 minutes after 11 o'clock, and we're wrapping up now. But Dr. Renee, I believe that we have covered so many areas about breast cancer. And there are people who will say, so why it only on the calendar once a year? It on the calendar, right? Every year. But this is a daily
Every
walk
year.
for
Oh yes.
everybody, for many
Oh yes.
people and
Absolutely.
families. And the
Absolutely.
fact that you were so moved when you think of,
Mm-hmm.
you know, your position, and then the flip side to that, you are empathizing with someone
Yeah.
because here comes a drastic change.
Mm-hmm.
Because we all want to look and feel good.
Right.
Yes.
Cup sizes may vary, but we want to know that we have them,
Yeah.
Yes.
Right.
right? We want
Very
to know
true.
that we have
So,
them.
with that said, sorry, since you're wrapping up, I have a poem that I'd
Yeah.
love to share.
Yes,
It has
Max. I was gonna
meaning.
rope you
It has
in.
some laughter. It has some laughter, and it also has educational part. So this poem, I wrote this poem in 2005, 11th of November, the 3rd of November 2005, and it's entitled "Weapons of Mass Distractions." They're always in pairs, not in the rear, but sitting in front, waiting to confront. The eyes that looks on is bound to get stick. These weapons of mass distractions are the almighty tips. They say it's the best. They say it's the best for the newborn child, but they sure do drive men crazy and wild. There's always a race when child is in charge. It's then man gets discharged and has to stay far. They have caused accidents on highways and subways, parkways and driveways, and even on byways. They are weapons, weapons of mass distraction. These weapons are greatly designed. They're alphabetically and numerically inclined. Braziers, as you will know, all carry a letter code. And if you ever wanted to know what these letters mean, then check out this scene. A means almost boobs. B means barely boobs. C means can't complain. D means dang. D means double dang. E means enormous. F means fake. G means get a reduction. H means help me. I have fallen and can't get up. When you get old, when they get old, they sag and drag. That's when they definitely lose their tag. These
Ah,
weapons of mass distractions were your every meal and a toy that sometimes put you to sleep. Respect them no matter what. They are distractions, and that's a fact. Thank you.
so it can go and soccer.
That's how it go.
Love that. Love that.
Yes. But
So
Weapons of
much.
mass
so Dr.
distraction.
Renee, your
Yes.
final comments before we go.
Yes. So I would love to encourage every man, every woman listening, sound of my voice. Your primary care, preventative health is very important. Do not wait until something is broken to get it fixed. Maintenance is going to be very, very important. Health maintenance at least one time per year, coming into your health provider's office just to make sure that things are good, right? We will get your blood work done. We will make sure that if there are any type of disease processes that you are at risk for, we will make sure that those are, under control, taken care of, and you can maintain and optimize areas of your life that really need to be optimized. We want you to live your best life, not just by saying it by words, but actually really and truly living your best life. I'm Dr.
Wonderful.
Renee Clarke from Dykal Health and Wellness. We're located here right in the heart of Fort Lauderdale. If you're looking for a primary care provider, or if you're looking for somebody to handle the weight loss or IV hydration or that erectile dysfunction, whatever, talk to us at 408
Oh, so you're close
You
to me,
name it, you do
Renee.
it.
I didn't
Yes,
know you were
we
close
are
to me right
right
here in Fort
off
Lauderdale.
of Federal Highway. Yes. So you can reach out to us, book your consultation
Okay,
with us, and we'll be happy to serve you.
And by the
I
way,
come in to
ladies,
see
and
you.
so in addition to her titles and so on, Ermin, pretty bright
Urban
girl.
Data,
Yes, we
baby,
discovered
Is that
that.
our bewildered lady?
No,
Winsome little
no
sister.
man. Who? No man. Aldit is bewildered,
Oh,
lady.
is all
No,
this?
no,
All
no.
this is the bewildered.
Hermin is Hermin daughter.
Hermie.
Herman
Not
handbag.
not bewildered.
No. And
That's
she
a
loved your
that's a
poem.
that's an inside joke.
She
Thank
loved
you,
your
Herman.
poem
Thanks.
too. Yeah, she loved the poem.
Thank you.
And Vera says, very good information and discussions. Thank you, Lady D and friends. All righty.
You're welcome.
So we thank you so much, everyone, for sharing. And don't forget, you can share this to somebody else. They missed the show. Say, hey, the discussion was so good. On a need for watch it. And while you're doing so, just ask them to share the link to Inside the Zone with at least 5 persons so that we
And
can get this
subscribe.
the subscription going up.
No charge.
There you go. You don't have to
Free.
pay no money, free.
It's free.
Exactly.
Yes, but thanks to everyone and ladies, it's a while we have not done this because everybody always rushing so much and have no time to do whatever. But I'm going to
That's
ask you
where
to
you
do
go.
it this morning. To do it this morning. But Dr. Renee, thank you.
Thank
Stay
you.
stay online with us. Jackie, I go with you first, but we're wrapping up everybody. Jax.
Oh, just remember people to feel up yourself. It's your body. Okay? And apart from that, you can get some pudding. I have one to deliver right after this. So you can get in touch with the pudding pan. And it's 917-533-2380 or puddingpantop@gmail.com.
Love it.
Yes, get in touch with Maxine Lance, aka Max Poets. Get the max out of Max. Yes, I'm a poet. I'm an authored poet. I have a book called Deep Thoughts. It's available on Amazon and Ex Libris, and you can purchase copy directly from me if you want it signed. I also do reggae music. I have 10 tracks out there, and I have a one that to be released on my birthday. I'm going to release it on my for my birthday. So you can link me up on all social media platforms. And you can also go to YouTube to listen to my songs. Thank you, Lady D, for this moment and this platform. And Dr. Renee, it was awesome having you here today. You
Pleasure.
really
Yes,
highlighted us. Thanks again.
indeed.
Thank
Thank
you
you,
so much.
Max.
Pleasure.
Shades of Color by Sharon for all your African American inspired gift items, greeting cards, crossbody bag, makeup cases, and things of that nature. Wide assortment. Hit me up on WhatsApp 646-342-6838. And thank you so much, Dr. Renee, for the
Pleasure.
very valuable information that we were given. And ladies and gentlemen, the month
Yes,
of October,
absolutely.
as you know, is designated as um, uh, Women's History Month, and alongside that, breast cancer awareness, or rather. The month is still young. Schedule your appointment. Please get
Yes.
yourself
Mhm.
and stay healthy.
And for yours truly, Lady D, Denise Gomez with Inside the Zone, a twice weekly radio program on Mondays, 5 to 7 p.m. with the Monday Drive, and Thursdays, 6 to 8 p.m. with Center Stage. On Saturdays, right here on the YouTube channel Satideh Mawnin Runnings from 10 to 11:30 a.m. Just to let you know that Inside the Zone Monday and Thursday shows are also being broadcast on Fit FM 96.7 in Jamaica, fitfmja.com, and them enjoying the show. What can I say? In addition, I am an MC. Stage production is my thing. Voiceover, audiobooks, commercials, etc. Link me up inside the zone nyc at gmail.com or 914-304-2592. It has been a blast of a day. Dr. Renee, you
Thank
brought your
you.
game. I know I know I can rely on you. So
Yes, ma'am.
You want piece of
Anytime.
my
and
Yeah.
pudding?
Just,
eh, eh.
Jackie.
it's not in my macros, you know. It's not in my macros.
Oh Lord. Temptation strong.
Yes, sir.
You don't want one of me, Shirley?
Yeah, yeah. Sharon's where you
And
have
I
to
am
show.
gonna go now and jump in the sea.
Put
You
your
want
Wait, where are you?
I
Where are you,
am in
Sharon?
Lord.
She's in yard.
What?
Dr. Renee, so we stay here. Get
Yes,
used to
yes.
us.
I
No,
love
I'm
it,
a calm
though.
man, it's
We're
Sharon.
a crazy bunch.
I love it. I'm here for
Oh my
it.
gosh. A little chocolate tea.
Right.
No,
So,
Jackie.
and
Nobody rub it in, sir.
by the way, this coming Thursday, Dr. Renee will be on with me in Health Zone on the
Oh wonderful.
radio
Okay.
program. So we'll be talking about whatever she decides to come up with.
Whatever.
Whatever. The last
Dr. Renee,
time, and we're
I gotta call you about a few things.
Of course, not a problem.
right. So
Okay.
check me.
Yes.
Oh
Yes.
yes, Dr. Renee, I have to call. I'm right here in Fort Lauderdale. So
Yeah, we're right here. Commercial
And Lady D,
unacceptable.
Lady D and Shirley, they're foreign today.
Yeah.
Yes.
Which foreign is the Lady D?
Big
where is it?
foreign.
Poughkeepsie.
Oh, today's
Okay,
a
good foreign.
funeral.
Mhm.
Today's your friend's.
Yeah. So I'm going to
Officer.
the repast.
Oh,
Mhm.
okay.
Okay.
All right. So
Condolences. I'm sure the
Yes.
chief boss is there yet, but she's not a mango for sure today.
Listen,
Not
our
a
Mango
friends.
mango.
done.
Magazine is over. I just got that
The
on
other day.
Tuesday. Yeah, it's over.
And,
oh
Period.
Come on,
Lord.
manage, you know.
Yes.
all
Period.
Okay.
right.
True.
So
Me I gonna
it's
eat me tea now.
All right.
so
Okay.
Dr. Renee, they say you must come back again.
Yeah, I think this was my
Yes,
third time. Kevin and I
yes.
will probably be on. I think he might be on with me on Thursday.
Okay.
Andrea killing me. Andrea said, Jackie.
Hmm. All right. So we're going to bless you and leave you everybody. You know, I
All
used to
right.
tell everybody me used to walk boat when me little.
Oh
So
no, me can't believe that.
I have matured. Huh.
Eh,
They
we couldn't
couldn't
left the
find
granny here. We didn't get beaten.
they couldn't find me half the time. From me
What?
finish me chores, me gone.
When them a look for me up in a some tree. Me climb every tree, banana tree, me climb.
You
Right.
fat.
And then when they find me, said, Dennis, come go up. Come gallop up.
Go up.
Go on up.
Yes.
Come go.
So
Oh, funny.
Blessings, people. Love you know.
blessings, everybody.
Happy bunch. Love you all.
Take,
Blessings.
Bye.
Nice to
take
meet
care,
you all.
everyone.
All right.
All
All
right,
good.
Dr. Renee, we out of here, everybody.
It's Breast Cancer Awareness Month, and woman, you are our priority. How often do you do your breast exam or have your mammogram done? Remember, early detection saves lives. So, put aside the powder, oils, myths, and stories about treating breast cancer because we have a doctor, Satideh Mawnin, Dr. Renee Clarke, a certified family nurse practitioner of Dykal Health and Wellness, ready to inform and educate you on the importance of taking preventative measures and self-care. At Satideh Mawnin Runnings, come, make we talk.